Hi. Okay, today I'm going to speak about a sensitive subject, newborn euthanasia and why it should be legal in the United States. The birth of a new baby is supposed to be one of the most joyous moments of a person's life. But what if this moment becomes a parent's worst nightmare? Is it okay to perform life-sustaining emergency techniques to save this child? If the child is missing part of its brain, is it okay to perform emergency heart surgery to close a hole just so the baby can live a few extra months? This is a baby that will never breathe on its own, never be able to walk, and never be able to look into its parents' eyes. I've been a nurse for 20 years, and for 7 of them, I ran an OBGYN clinic. For the past 2 years, I've been at a skilled nursing facility for children. I have been on both sides of this medical dilemma. As an OB nurse, you want to do everything you possibly can in order to save the baby. Once that baby is well enough to be transported from a neonatal intensive care unit to the skilled nursing facility, it is now our turn as nurses to inform the parent that this child will always be on a ventilator to breathe, will always have a tube in its stomach in order to get nutrition. It will never walk. It will never talk. It will never look into your eyes. It will never be able to smile back at you. It will never say a first word. The history of decision-making on life-ending treatments for a newborn was always based on the doctor's personal judgments and not on the care and suffering of the family and child. Today, I will discuss life-ending decisions that are made in the best interest of the child, the costs associated with caring for critically ill children, and pain and suffering of the child and family. Newborns are born, some, with multiple defects, are born under emergent circumstances that may not survive or will have a lifetime of suffering. Any life-saving measures on these children is not in the best interest of anyone, especially not the best interest of the child. Euthanasia means good death. The definition means it's the act of intentionally ending the life of a terminally ill or suffering person for reasons of compassion and mercy. The U.S. regulation changed in 1973, where it removed the focus from the federal government and put it onto each state's Child Protective Service Agency to determine when end-of-life measures are allowed for a newborn child. The rule was specific and defined for brain-dead children that would not survive, those with very poor prognosis that even treatment would still lead to death. Treatment would not aid in the survival of a child, or that treatment would be inhumane. The parents had little choice in this decision. Costs and suffering were not a factor. This did help doctors make better judgment calls in deciding what child should be allowed to not suffer and be allowed to have life-ending measures in place. The statistics for critically ill children: 520,000 babies are born premature under 37 weeks. Medical advancements save even the tiniest and youngest of these children that are born before 25 weeks and weighing less than 1 pound. With medical advancements, these children are surviving. 50% are surviving. But that 50%, most of them will die within a few years or have severe disabilities. Critically medical children. There are 3 million out of the 76 million children in the United States. 33% of all healthcare spending is on these critically ill children, and over half of that spent is when they are hospitalized. And that equals over $18 billion a year. Critically ill newborns are based in 3 categories. 1, there's no chance of survival. 2, a poor prognosis even with intensive care. 3, a poor prognosis which the family and doctor deem will cause unbearable suffering. Once you understand the outcomes of saving a critically ill newborn, we begin to understand why the law should allow medical staff and families to decide the best course of action for their child, and it should not be up to a hospital or a state to make that decision. We need to be able to justify life-saving or life-ending techniques. We need to be objective in determining the role of the child and family best interests in this decision, as well as having the medical team provide the guidance and prognosis. Sometimes initial treatments are going to be needed to determine a correct diagnosis and prognosis of a child. An end-of-life course of action is not an easy decision for anyone. You want to limit the pain and suffering to the child, as well as the pain and suffering that will be caused to the family. With life-ending techniques, we can use muscle relaxants once artificial respiration is stopped that won't shorten the life of a child. If the child is gasping or suffering, or if the family is not able to watch the child gasp, we could add muscle relaxants to end the child's life. Withholding life-saving techniques is legal in other countries. Euthanasia of newborns is legal now in the Netherlands. Then they use the Groninger Protocol. The Groninger Protocol is a regulation that is practiced in Europe that prevents the unjustified killing of the newborns. They have 5 criteria that need to be met. 1, the diagnosis and prognosis must be certain. Hopeless and unbearable suffering must be present. It must be confirmed by an independent doctor. The family must write a written consent, and it must be performed under medical standards. Considering life-ending treatment is a discussion that's made between the parents and the medical team. The doctor's interest is the child's well-being. Doctors can override a family's decision if this doctor knows the child will have unbearable suffering or is not going to survive. They do take into account the impact this has on the family, that the family needs time to grasp what is going on and the child's hopeless condition. The decision is not to be taken lightly when to not initiate or to withdraw life-prolonging treatments. This is considered good practice in Europe, and once these treatments are stopped, the baby normally dies shortly after. There are infants that survive with medical technology, but they will have ongoing suffering and no quality of life. Palliative care is given to these families and this child when they know that the child will survive, but may only live a few months, a few years, or may live to a lifetime. Palliative care helps the family through the process, helps them with the grieving process, and makes sure that the child is not suffering. Although it is horrible to consider ending the life of a child, once you understand the reasons and why letting this child live would cause unbearable suffering, expenses, and pain to the child and the family, and knowing that allowing these families to bond with the child and being able to say goodbye and letting go is a way to aid the family with a positive outcome. I want to end by saying that not all births are joyous. Some children are born with terrible defects. They're born too soon and too small to survive. They're born under emergent circumstances where they lose oxygen to their brain. Death or a lifetime of suffering is inevitable. This is why newborn euthanasia should be legal in the United States. Thank you. Bye.